Very good evening. Over the course of the next half an hour, we will be taking your questions around the coronavirus. We have two specialist doctors joining us on the broadcast this evening. Dr. Arunesh Kumar, Chief Pulmonologist and HOD of the Paras Chest Institute in Gurgaon, is joining us on the broadcast. We also have with us Dr. Balveen Biba Singh. She is a certified physician as well as a specialist in psychiatry. So if you have any questions, do call us on the number there flashing on your screen, and we have two expert doctors to take on your questions. I want to, if I can take the liberty of asking the first question. Dr. Kumar, to you first. There are many questions that are being asked about the incubation period. There are beliefs that the incubation period could be as long as even 21 days. Is it possible for somebody to be a carrier of the infection without exhibiting any symptoms whatsoever?
Yeah, it is well documented now, and we do see that a large majority of the patients who are actually infected with the virus may be asymptomatic, and having no symptom doesn't mean that you can't transmit the virus to others. Sometimes when you exhibit symptoms, you are treated, still following the complete cure of the virus, you can still be a carrier and you can infect. So, and that can range up to 3 weeks. Sometimes, patients at the end of, say 21, 22 days, the papers have come that they have found, they have repeat viral swabs have shown the presence of viruses, not only in the throat secretion, but also in the excreta, in the feces. Sometimes it is there. But for all practical purposes, for the public, I think it is suffice that, 2 weeks rule, which has been the basis of, quarantine and everything should be there.
All right. So it is very important for viewers to take quarantine very seriously, because, like Dr. Kumar is saying, you could be a carrier and couldn't, without exhibiting any symptoms. Our first caller, Aisha, is on the phone line from Srinagar. Go ahead.
Hello?
Yes, go ahead. We can hear you.
Good evening, sir. Recently, I was in Saudi Arabia and I came on 16th March. One of my fellow mates of our group was the first COVID-19 case in Kashmir, and mostly few more persons became positive. After that, I completed my quarantine period under medical supervision. Until now, I have no symptoms. My first question is that, is there any chance to be positive without symptoms? And secondly, I have a little daughter. Can I be with her as I have completed my quarantine?
Right. Dr. Kumar, I think that question's for you.
Yeah. Thank you very much for the question. 14 days has elapsed since the day possibly when you had that contact with the person, index case, and you have not exhibited any symptoms. So most likely you are not going to have an active disease because 14 days has elapsed. Now, it's always good, we just discussed that sometimes there are occasions when the patients can still be, even 23, 24 days, you can be carrying that virus and you can infect others. So it's worth keeping an eye on your daughter. As long as she doesn't exhibit any problem, if she doesn't have any symptoms, you are okay with that. So you don't need to worry about it at all.
All right. Our next caller, Meeta from Gurugram, is on the phone. Dan, go ahead, Meeta.
Hi, good evening. I wanted to understand, so I just heard a few minutes back that Dr. Harshvardhan was saying that there was the first case that was detected in January, and now we find out about the Nizamuddin case where so many people have got infected. I'm trying to understand if that this community transmission would have probably happened if these people have been traveling, how many things they would have touched, what surfaces they would have touched, how many places they've gone, so community transmission has probably already happened. And I'm trying to understand, if we haven't tested enough, obviously our numbers are very low. So what do we do about that? Because psychologically, that will make a lot of difference.
All right. Dr. Singh, do you want to take that on? Because, there appears to be many questions around, India says no community transmission yet, no local transmission. But, do you want to just clarify? Because there also, after the Nizamuddin episode, appears to be a lot of panic. People are, wondering whether the next person they see is, could perhaps be infected. You want to take that on?
Sure. So basically, I think that you have to assume that anybody you see could be a carrier. So always just protect yourself, because you don't know. Even if they don't have any symptoms, they could be carrying the virus, right? So the best thing to do is just always go with the attitude of protection. So always sanitize, wash your hands. Anybody you meet, stay 6 feet away. I think India has done an amazing job of quarantining and doing this 21-day, rule to stay in. I wish that the U.S. I'm in New York right now, and New York and America is affected very badly. And I wish that we had done the same. And now it's pretty late. And
all right. So prevention is the call that is being made by most doctors. Be careful, but don't panic.
Right.
And of course, you have to trust the authorities to do what is in your best interest. Shailendra from Mumbai is joining us as well. Shailendra, go ahead with your question.
Good evening, doctors.
Good evening.
I have a question. I understand that all the people have been advised to use alcohol-based sanitizers to sanitize themselves from the possibility of getting the COVID-19. I wish to understand that in case if alcohol is effective on COVID-19, why is it that alcohol is not being tried to give as a prescription to kill the COVID-19 in the lungs if it gets infected?